And there's certain components and services that are required if you're a CCBHC. So over the next year, we're going to be working with the community mental health centers to develop this model, incorporate these standards, look at the payment structure to where we can transform our community mental health centers into CCBHCs. And the key to that for this commission is crisis services are a focus of CCBHCs. So we'll be able to have more of an emphasis on that as well with the community health center. So that's just a few of our goals for the state through the Department of Mental Health and through strategic planning and funding that's been made available by the Mississippi Legislature. Before we move on through the agenda, does anybody have any questions about anything that was just presented? Can you see how some of those goals and some of the information that we've provided can work with what the commission is doing? And I know we have Mississippi Ambulance Alliance on here. We've got the Association of Police Chiefs, MEMA. All of these agencies and entities respond to crisis situations. So you can kind of see how hopefully this is going to build upon what you are doing as well, and to provide assistance to help you in your role in the community too. Okay, we don't have any questions. We'll move on, Katie.
All right, good morning. My name is Katie Storr. I'm also with the Department of Mental Health, and I'm going to talk about some of the collaboration efforts and funding that we have received so far for 988 and some of the funding we're hoping to receive in the future and allocate. We talked a lot about the crisis system in our first meeting, and there is a recording of that meeting and a PowerPoint presentation for anyone who was unable to attend. But we talked about how the purpose of this system is to almost serve somewhat as the 911 for behavioral health crisis care. So we are focusing on trying to build capacity at our Lifeline crisis centers. They are the call centers that take the calls, the texts, and the chats, while also having a long-term goal and vision for connection of all of the pieces. So you have someone to call, someone to respond, and somewhere to go. The someone to call has been our short-term goal while working to connect all of the pieces with 988. And we have 2 in the state that work really well together and work to get us that 98% in-state answer rate. And you'll hear from one of those executive directors in just a few minutes. But I wanted to talk a little bit about some of our coordination efforts since the last time we all got together. And one of those has been for some dispatching protocols with our 988 centers and then our mobile crisis response teams. In Mississippi, we've had mobile crisis response teams, and those have been funded since 2014. And they are able to respond in the community to someone who is experiencing a behavioral health crisis. They are operated by our community mental health centers. And since they are operated by the community mental health centers, there are 13 going to be 13 to 12 teams in July that all operate a little bit differently with their own structures, as long as they're following, of course, our operational standards and meeting the purposes of the grants that we provide them. So we've had to work on some coordination protocols for these and how that dispatching will work. So each 988 center and mobile crisis response team worked in collaboration to add input and feedback to this document. And it gives some guidance on the decisions that the 988 call centers use, those counselors, when trying to decide if a mobile crisis team needs to be dispatched. Those mobile crisis response teams have their own crisis line. And right now they still maintain those lines. And we're also promoting 988 along with it. So they have all been in the practice of answering their own phone calls and then determining if someone needs to respond face-to-face. So that was one of the big differences with this, is that we're asking them to trust those 988 crisis counselors to decide when that face-to-face dispatch needs to happen. So we talk about the guidance on decisions for that. It outlines the dispatching process. Right now it is a telephone call, and then a process for resolution. So if the community mental health center does not feel that it warrants a face-to-face response, yet the 988 crisis counselor does, there's a process for a resolution with that. and someone on call with the Department of Mental Health that can step in and help in those situations. And I'm happy to report that none of that has happened since these protocols became live in September of 2022. No one has had to call our on-call person here at DMH to help work through that. So this is an exciting piece for connecting the system. We hope in the future that there's a technological solution for this outside of a phone call. These teams now meet monthly. They review data. They talk about successes. They talk about where there's gaps. They talk about maybe some of the times where the call didn't go exactly how they wanted. And so all of our mobile crisis response teams and then our 988 centers are meeting monthly to continue work on this. Some other crisis care coordination that we've been focusing our efforts on is follow-up care. So you have someone to call, you have someone to respond, the somewhere to go, but wrapping around that person to make sure that they continue to get the help that they need. The 988 call centers, they do perform follow-up calls to anyone who calls consenting for them to call them back to see how they're doing. As another layer to that, we're working to partner each community mental health center with the 988 Lifeline Center to also perform follow-up calls. So we have been in a pilot program with Communicare, which is the Region 2 Community Mental Health Center in Oxford. They have a pilot MOU with Contact the Crisis Line for about the last 6 months, maybe 7, where they have developed some protocols that a designated staff member at Contact the Crisis Line will send the names and contact individuals of people, contact information of individuals who live in their catchment area and who have consented to be contacted by Communicare. They'll send that in a HIPAA secure method to Communicare, who on their end agree that within 24 hours will contact that person and attempt to set up a follow-up appointment. We are also currently in conversations with Hines Behavioral Health Services to also get an MOU. They're both reviewing the document right now, and we anticipate this to be signed here in the very near future. And then another successful area, and that's Region 9, right here just in Hines County. I did mention that it's somewhat like the 911 system, but I do want to say where it's different is that 988 is the service. It's not just a dispatching sort of system. They are the service. When you call 988 or you text 988 or you chat 988, you're getting one of the trained counselors, and 85% of the time that call can be handled over the phone with that counselor. There has been a lot of federal attention to 988 for it to be successful, and a lot of funding that has been provided to the states through SAMHSA, which is a Substance Abuse and Mental Health Services Administration. And they have done 3 grants, 2 that are active right now, and 1 that we just submitted a proposal to on Friday. So we're waiting to see if that will be funded, as we've described in our proposal. The first grant that they've provided is there at the top, the 988 State and Territory Cooperative Agreements. It was active in April 2022, and it runs through April of 2024. And you can see how we split out the funding for that grant to the 2 crisis centers. And then the money that we retained, which was for project evaluation here at the Department of Mental Health. Through those funds to the crisis centers, they were able to hire 12 new staff and provide assist training for each, purchase 10 computers and 6 VPN phones. And then within the life of that grant, SAMHSA came back and they released a supplement. So it wasn't a separate grant, but it did have new goals. The first grant's goals were to build capacity. Let's hire some people and get the equipment needed to be able to answer calls. And the supplement was more about connections and also speeding up recruitment, because this came out during a time where it was hard to hire and hard to recruit. So this grant had more about collaborations and consultants that everyone could hire to try to help with some of the goals. And through the supplement grant, it funded a 988 consultant that we're currently in the process of going through procurement. And we also carved out $15,000 that we could use for printed materials to help us with communication and public awareness. And then the rest of that went to the crisis centers. to fund 988 printed materials for them, an HR consultant, a data consultant. They can either purchase or enhance their HR system. A big piece of this is consulting and engagement with the tribal communities in each state. So this was to help them with that engagement with the Mississippi Band of Choctaw Indians, and then also some money for recruitment ads for them to hire positions. And then this last grant, like I mentioned, we have not gotten a notice of award. We have only submitted our proposal, but you can see how we have proposed to use those funds. This grant's purpose is also to build on the other two, allowing us to hire some new positions at the Lifeline Center, and then also continue working on connecting all the pieces of that crisis care continuum. So what we proposed for the new one is to fund an additional 16 positions and provide assist training for those at the Lifeline Centers. For the Department of Mental Health, we hope to fund 2 part-time positions that can serve as 988, a project director, and then 988, we're calling it an operations coordinator that's going to help us build collaborations with first responders, 911 operators, and then also the Mississippi Band of Choctaw Indians. It's funded consultants to help both with assessing the crisis system and then the reporting mechanism of this study commission. And then also a technology consultant that can look at the systems used by the 988 centers, the EHRs used by the community mental health centers, and help develop recommendations on what would be good technology to use for the connecting of all the pieces of the crisis system continuum. And then I have future allocations and then what's currently allocated to those 3 pieces of the crisis continuum right now. And that includes the 2 top grants that I had just mentioned for the Lifeline Centers. You can see the funding that Department of Mental Health subawards to those centers. The amount, this is just what the Department of Mental Health provides, not any Medicaid reimbursement from the teams, but that's $5.2 million statewide for mobile crisis response. And then almost $30 million for crisis stabilization units. And Wendy mentioned earlier, that was for 180 beds throughout the state. We did have a change in some of our beds during the last fiscal year that I'm going to mention just so you're aware. That there were 8 beds in Marks that closed, and that happened with the merger of Region 6 and Region 1. And that's because Region 6 already had 2 CSUs in their catchment area. So that funding will go toward additional beds in a different area as well. Natchez also added 4 more beds for a total of 12 in that area. Additional future allocations, the 988 call centers, we were provided with $3 million in the first year from ARPA funds. $2 million of that is going to go directly to the 988 call centers to fund what they project as needs in equipment and staffing to be able to answer calls, texts, and chats on a 24-hour, 7-day-a-week basis. We were also given $100,000 per team for mobile crisis response teams, and that funding is to go directly into staffing. Everyone is having staffing shortages statewide and throughout the nation, so they are to use that money in ways to build up their staff so that they can respond whenever needed. And then another $6.5 million for crisis stabilization units, and that's to add another 60 beds statewide. Okay, before I turn it over to our next presenter, does anyone have any questions about that section?
Katie, what's the timeline on the 60 beds for the CSUs?
Well, those are funded through ARPA, so we're working through being able to distribute those funds. And then, of course, they're going to have to find the space in the building. So we have until fiscal year 2027 to use them.
We do. And 2 of the community mental health centers are a new CSU, and that's Region 8 and Region 9 based on commitments, and they have both secured a location. The rest are, if the CSU was say 8 beds, Jerry, or 12 beds, it's to get them to 16 beds. So in some areas, they just may have to have a few modifications, and then they'll be able to have the space.
Great.
Any other questions? Okay, I am going to stop sharing my screen. And we have with us Dr. Zhu, who's part of the project evaluation team that's been looking at the data from our SAMHSA grant, some of the goals that we have to meet in that project, and he's going to present some of the findings and trends.
Thank you very much. So give me a few seconds. Let me get the presentation going. Can you all see this?
We can.
Thank you. Once again, my name is Xiaohe Xu. I'm going to present some results of our evaluation analysis on behalf of the evaluation team. Our evaluation analysis is based on two publicly available reports. The first report is 988 broad state matrix. So that's a state level centered report. The second report is a center matrix breakdown report that allows to go to Mississippi counties. The goals of this evaluation or assessment are twofold. First, we want to highlight what the program staff have done well over the past 2 years since 2021. And we want to identify areas where improvements can be made in the future. So our analysis was conducted along two dimensions. One is trends over time. The time frame would be September 1st, 2021 to May 31st, 2023. And that's most recent data we received from the project team. By the way, they regularly forward those data sets to us. Thank you. Secondly, we want to present spatial distribution by Mississippi County. So we rely on county level metrics. So without further ado, let's get into this. First, let's look at state level trends over time. Here, figure 1 presents the number of calls or answered. We want to make sure this is perceived easily or as intuitive as possible. What you see here basically is suggesting a couple of seasonal patterns. That is, we have August, September, and October month that seem to have a larger number of calls compared to other months. We also suggest there might be some sort of winter month or early summer month troughs as well as 4-month peaks. This may have implications in terms of prevention efforts, treatment efforts, and the resource distribution. So in other words, we may need to pay more attention to the 4 month. Not necessarily limited to the 3 month, but based on short-term data, we make that suggestion. Of course, depending on future data points we may receive from this project. Figure 2 represents the answer rate for the whole state. I think we already learned that from previous presentation. Mississippi fares very well in the nation. We are in the leading pack of 10 states with high rates. So for example, by October 2022, our rates, it's about 97 or 98% stabilized and level off. So that's quite remarkable compared to other states in the nation. Some states have as low as 60-some% answer rates. Figure 3 shows state demand in terms of text and the chat, as we learned previously again. Starting April of 23, we also started responding to a text or chats. But there's interesting crossover though. It's in November 2022. So text for the first time exceeded chat. So interesting reversal. Figure 4, we look at number of calls handled by 2 call centers. Again, this is by division of labor. We see the Jackson Center handles the vast majority of calls compared to the Columbus Center. And the pattern of the spatial distribution is similar to the one I presented early on. So they are seasonal patterns as well. Next, in terms of call rate distribution, and we see Columbus Center lagged behind in most of the months of the 2 years, but recently, by May of 2023, there's a parity. So hats off to the Columbus Center. They really made a stride to increase call rate quite consistently. Now let's look at the county level spatial distribution. I want to warn you on that though. We focus on the first 5 months of 2023. I will go through these maps rather quickly and give you a summary statement, as maps pretty difficult to decipher. So here you see January of 2023. We see all the counties listed in the map. Look, majority of counties have 100% answer rate. That's dark gray. Okay, the blue color indicates no calls. So other than dark gray and the blue, only a few counties that have less than 100% call rate. I'm going to summarize the finding later on. This spatial distribution holds for February. Look at dark green, 100%. That's almost the entire state. So quite well. Also holds for March. Look at those brown counties. Also holds for April. Look at the purple. Okay, the program changed the color. I did not, but it's colorful anyways. So in April, we see similar pattern. And not surprisingly, in May, we see the same pattern again. So in order for us to provide summary statements about those maps, and here is, you can see detailed information by county, okay? For example, in January, we see these counties did not have 100% call rate. As a matter of fact, there is a county that has a lower rate, it's about 60%. So clearly, there's a room for improvement. Same pattern for February. We have 3 counties. March, 2 counties, or maybe 3 counties, depending on the threshold. The same pattern holds across first 5 months. So generally speaking, the number of counties with 100% answer rate increases steadily over time in 23. So that's a good sign. The number of counties without calls increases steadily as well over time. However, we need improvement in counties that do not have 100% call rate. Keep in mind though, there's a caveat. I need to make sure we are on the same page. Since the calls are routed based on area code, that does not mean a particular person made the call from the county. Okay, could be outside county, but we don't know. And secondly, even if we know the calls, for confidentiality reasons, any county, the number of calls less than 6, it's just less than as a sign, 6. We don't know exactly how many calls they are using public record, but we do know if we can get on in the data. So these patterns are tentative unless we have more detailed information provided for us. Okay, next one, again, please do not point the fingers. I want to make sure we all understand that some of the counties made on my list of top 10 counties in call rate per 100,000 population. So this is standardized, all relative to the population size. As I put a note here, they came from the 2020 population estimates program and the 2021 American Community Survey. So these are the population estimates. Okay, regardless, we see 3 counties consistently across the first 5 months in 2023 made the list. That is the Hines, alphabetically arranged, okay? Lauderdale and Washington. So please make note, we probably need to pay a little bit more attention to these counties in terms of prevention, treatment, and resource distribution. In addition, I'm not sure how interesting this is, but I want to make sure I point them out. Sharkey and Lawrence made #1 twice in 5 months. So January, February, that is Sharkey, and look at Lawrence in March and Lawrence in May. So something unique about those 2 counties, again, relative to the population size. And of course, the number of calls may not be precise since we don't have detailed information, right? And these findings, I think, and the research team also believes that the case, that they have implications for prevention and the treatment in the future. And of course, it has a lot to do with resource distribution. Where and when we need to spend a little more money or manpower in terms of the seasonal patterns and in terms of the spatial distribution across Mississippi counties. To conclude this presentation, our findings provide useful information, but also point out what we have done very well. For example, we are in the leading pack in terms of answer rate in the state of union. So that is quite remarkable. And of course, look at county level data. We do have some holes. We need to fill those holes in our future effort. I'll be happy to answer the questions you may have if we have enough time. Otherwise, I can make this presentation available so that you can direct questions to our research team, our evaluation team, or myself. That is all from me. Thank you very much for the time and also your attention. Terry, you can fill the gaps.
I don't know that there are any gaps, just lots to consider here in terms of, like he's saying, resource distribution, like where the outreach efforts may need to go. And maybe looking at some of the counties that have higher call rates to see, is that where the outreach has been directed? Like, so that would show success in the outreach. So a higher call rate is not a bad thing for a county. It just means they may be more aware of the information, more aware of the 988 call line. So just things to consider that the 988 team can get together as you guys plan for outreach. And as you guys plan for, as he says, you know, in those fall months, maybe the call centers may need to increase staffing, increase backup for the call months in anticipation that those calls are going to go up in terms of number. So yeah, just lots of things to consider and look at. And those spatial distributions can be really helpful. If you see counties that have 0 calls coming in, that tells you that maybe they're less aware, you know, like the information Ms. Bailey presented at the beginning, where this a smaller percent of people are even aware of 988. So if there's 0 calls coming in from particular counties, you want to let them know that the 988 number exists, because we know there's probably people in those counties that need that number. It just means we need to direct some resources out.
Just provide one more piece of information. Our evaluation effort in next couple months will be on referrals. We do not currently have the data yet. Once we receive information from the project team, we're going to work on that. Thank you. questions?
Thank you very much, Dr. Zhu. That was an excellent presentation. Excellent data for us to consider as we look at making these recommendations. And as Jerry mentioned, as we look at where we need to target outreach. And that's the purpose of the data. And we want to absolutely use it for that reason, to be able to guide us in our decision making as we move forward as the commission. So thank you very much. Excellent information.
You're welcome.
The next person on our agenda is Brenda Patterson. She is the Executive Director of Contact the Crisis Line. So Brenda, we're going to turn it over to you.
Thank you. Thank you for the opportunity to talk to you a little bit about Contact the Crisis Line, the work we do as it relates to 988, and then thoughts about the future and the importance of 988 and its ability to sustain itself. First, a really quick background of Contact the Crisis Line. As a local helpline, we've been taking calls since 1971 and we're accredited by the International Council for Helplines. In addition to taking local helpline calls, we are also the after hours for the State Department of Mental Health, and we're the 24/7 HIV/AIDS hotline for the Department of Health. We take calls for the Episcopal AIDS Committee, the Compassionate Friends, and we're also on NAMI's national roster as being one of 2 warm lines for Mississippi. So it's statewide program that we also offer through Reassurance Contact, in which we make outbound calls to seniors living alone. It's our volunteers that make the calls. And I just wanted to mention that to kind of let you know that we do have a strong background before we even entered into taking calls for the National Suicide Prevention Lifeline. So let's talk about the Lifeline. Contact became part of the Lifeline network in 2012, meaning calls made from a Mississippi area code came to us. At that time, we were not 24/7 for the Lifeline, but we were honored in 2018 to have a grant, to be granted one of the only 2 first sustainability grants through the Lifeline in SAMHSA. That was when we set up a dedicated staff to take only Lifeline calls. Contact was successful in increasing our in-state response rate from in the 60s up to the 90s. And it has remained that, as you've seen on previous slides, and we have not looked back. Today, we take around 1,000 calls a month dedicated to the Lifeline, but we also take another 1,000 or so calls on our regular crisis line and the after-hours services. Staff has increased to meet the needs during the increased volume times that was mentioned, because yes, there are different times of the year where there's going to be an increase, and so we try to have staff available, backup staff for those times. Currently, we have 13 dedicated 988 crisis counselors, and we have 6 contract that also assist with our volunteers on the crisis line side, in addition to 2 administrative staff. And so far as volunteers, we have trained volunteers that also work our regular crisis line. And we have around 40 to 50 dedicated, though there's actually a few more than that, and some of whom are interns, because we try to meet the needs of our local universities and with their internship hours that they need. We currently have interns from Mississippi College, from Belhaven, and USM and Millsaps. So that is another kind of something we're really proud of to be able to offer. So back to 988. So we have looked back at the staff, we've increased, and the grant that we got, the sustainability grant, ended, and that's when Department of Mental Health picked up the contract so we could continue the important work. So July 16th, 2022, 988 officially went live. So that meant you no longer had to call the 1-800 number. You could call 988, and even more, you could text 988, or you could go to the website and click chat now and be able to chat. This is a game changer. This is such a game changer in a number of ways. We know that suicide is the 2nd leading cause of death amongst our teens. We also know that 80% of the calls to 988 are managed in the call and need not go beyond the call. But guess what? Our teens don't pick up a telephone and call, but they do text and chat. And so Contact has been accredited to do chat and text since 2012. And on a small scale, we have been able to take chats and texts through the Lifeline. The majority of those chats and texts are from individuals that are under the age of 23. So that is really the key to being able to reach our teens and our kids. We've actually had texts and chats from kids as young as 8 years old that have come. So we really see the importance of this for a variety of ways. We have recently, as Katie mentioned, started taking chats from only Mississippi. So that was our next big step in trying to meet the needs of our teens and our young adults. Unfortunately, having the capacity to do 24/7 with chat and text is where we are really kind of struggling with. We're wanting to utilize some of our interns, but that is something we really need to take a close look at, because we do get around 300 chats a month, and that's with the information that we've got now. We do feel like that as marketing continues so far as 988 in general, that's going to jump. That is going to jump, and so we want to really be prepared when that jump happens. Like was mentioned before, some counties that we don't get phone calls from, sure, there's people that's going to need that kind of assistance, and we need to be there for them when they begin to find out and reach out, and by telephone or by chat or by text. Also, I think it's important to note that the current grants that we have received, there are stipulations that are part of those grants that are very demanding, and require manpower in order to meet those criteria. So it really is important to have a plan in place for when the grant's in, and for us to be able to try to do with chat and text what we're doing with our phone calls. Of course, our 988 staff, I'm very proud of them. They have done a fantastic job. Many of them were volunteers long before 988 began, which is another reason I wanted to mention a little bit about our history. So that's how we got our staff started to begin with. I'm really very proud of them. I know that was a lot of information. I am interested in hearing questions or comments about what I've just presented, and also thoughts about chat and text. We are really, really excited about being able to expand that, with new ideas and plans for funding it, and not just funding it now, but funding for the future, because this is only going to increase. It is only going to increase. And I think it's also important to note that because we are a rural state, these are all services that people from anywhere can reach out to, and no matter where they are, and it's not a cost to them at all. So I think that's also going to be very important so far as our sustainability and the need for it. But I'll kind of stop now and kind of take questions or comments about our program.
Any questions for Brenda? Brenda, we thank you for your leadership. You are a phenomenal leader for 988 in Mississippi. I mean, you can clearly hear her passion when she speaks, and you can see her and her team's excellent work when you look at the answer rates. And she's right. I mean, this is, no matter where you live in Mississippi, you can pick up the phone, call 988 and get a trained counselor. And that's very important, especially for our state, and where we do know there's gaps in resources. And we also know, because of the rural nature, sometimes it's just difficult to have a counselor available. So this is an excellent option. And you brought up a good point when you said, as more people become aware, the calls are going to increase. And that's one reason Katie leads our 988 efforts here at the Department of Mental Health. And I mean, some of it's also, the lovely red tape of state government and federal grants, but it's also strategic, and we want the call center prepared for this, and they needed to build up their staff as well. So the communication piece really is strategically being rolled out and enhanced over time to where we can make sure that 2 call centers in the state are ready as well. Excellent job, Brenda. Okay, so the rest of the time for our commission meeting, we really want to open the floor. And everybody's been kind of quiet, but we want to hear your feedback and have some open discussion related to the report that has to be prepared for the Mississippi Legislature. So as I mentioned in the beginning, the report is to be submitted on November the 1st. Our goal is to have a draft to the commission to review by mid to late September. So what we would really, Katie, I'll tell you what, can you get back to that slide in my presentation in the first part? Number 4, actually, right there. Okay, so these are the 5 areas, I apologize, that we need to consider when we're preparing the report. So between now and over the next, say, 30 to 45 days, we would really like you as a commission member to contact us, reach out to us. You can set up individual calls with Katie and I, or you can send it to us via email. But we really want to get your feedback for these 5 areas of the report. Particularly, Ken from the law enforcement perspective, Drew from the Medicaid component, we're going to need some of the dollar amounts for number 3 for the Medicaid funding piece. Also, Dennis, the Ambulance Alliance. I mean, we really need to look at, from your perspective, you were selected by the legislature for a reason to be on this commission. So we need your insight and your perspective in these areas as we're compiling the report and submitting the recommendations. Let me give you one example of something that has come to light. So we have crisis stabilization units that are operated by the community mental health centers across the state. Well, one thing that has come to light is if you call 911 or if you call a mobile crisis response team and they go out and they think that individual could be served at a crisis stabilization unit, instead of having to go to the local ER, which is the goal, to serve them at that crisis stabilization unit, because that CSU is not connected to a hospital, many times emergency response cannot transport that individual in an ambulance. They can only take them to an emergency room. And this is due to statute that's part of code with the Department of Health. So this is one thing that we've had some conversations with the health department on. Is this something that we need to look at? How can we address this to open up that avenue that mobile crisis can make a recommendation for a CSU placement, but they may need that transport piece, not by law enforcement, but by an ambulance. And how could we work through and make that stronger in the state of Mississippi, the transportation piece and that communication piece? So that's just one thing that's come to light. But we really want to hear from you and just some initial thoughts of either recommendations that need to be made or just components that we need to address here, especially in the barrier section for number 1. So thoughts from the commission members.
So this is Dennis Hebner with the Mississippi Ambulance Alliance. So you bring up an interesting point about the ability to transport to other than the emergency rooms. So I'd be glad to work with you on that and talk with some of our members. I don't know if that would be able to be done at the state level, because usually what we do is we'll bill Medicare, Medicaid, private insurances for transport. But I think it would, I know working for a hospital system, they definitely would like to see these patients go to the appropriate care facility, because a lot of times they get into the emergency room and they're there until they can get them admitted into a short-term facility. And that might be another angle to look at is there something that can be done to help the hospitals to connect them up with partners to take on these people? I do have a question about the mobile response team. Do you guys track how many times that is going out and who's utilizing it county to county?
Yes, that is tracked. So prior to FY 23, which we're currently in, it was paper reports, but we implemented an electronic data collection system this last fiscal year. So we've had some growing pains and we've learned some lessons through it. But when a call comes into a mobile crisis response team, it's actually placed in the system. So we can also see the response time. So we see the county, the community mental health center, what was the disposition, and the response time as well.
And who makes up the mobile response teams?
The mobile response teams are made up, it's a team approach from the community mental health centers. They need to have a master's level clinician. Although you don't have to have a psychiatrist or a psychiatric nurse practitioner on the team, they have to have access to contact or connect with one 24/7 if needed. But the teams themselves can have bachelor's level staff, a peer support specialist, your master's level employee. And I was going to mention on the data, that's one of the pieces we're looking at with technology. Although our data is 95% better than it was for paper reports, it's still hand keyed by somebody on the other end. And I would love to have the system where it automatically tracks the calls and the location and response times and such.
Well, if you don't mind, I'll be glad to speak with you offline and see if, I think when we have a meeting, maybe have a short presentation, and then we can get the minds together to figure out what we could do to help the commission and make this 988, I guess routing them to the proper place. I did speak with our 911 service here in our county, and they're aware of it, that's good. I think awareness is definitely something that needs to be continually worked out, and making sure that the right partners are being made aware of this service, because it's a great thing, and it's a huge drain on the system, and probably more than just a drain. These people in crisis, they need to be to the right people at the right time, and not be held up in the system somewhere. Thank you.
Excellent. Thank you for bringing that up. And in the beginning, when you mentioned, you don't know for sure if it's something we can address on the state level, or you're exactly right. It's a little bit different in every state. We do have a study that was done by NRI related to that specific barrier, emergency response and transportation to crisis stabilization units. And there's been several states that have already worked towards introducing legislation to try to remove that barrier. So we do need to do a little more research and digging. Is this going to be a local level issue? Is it going to be a state issue that could be addressed, and how we can work through that? So I appreciate you lending your expertise to help.
No problem. Thank you.
Thank you.
If I could have some input, of course, I understand why I was put on this commission. I think I do anyway, or the study group, because in probably the greater majority of these situations, law enforcement's the first ones at the first one there. And I'm sitting here listening to talk about barriers, and maybe in some of the larger jurisdictions like Oxford, DeSoto County, the metro area, the Gulf Coast, those areas have addressed some of these things. But when you get into some of the smaller, more rural counties, I hate to say this, but at the end of the day, it's going to fall back on law enforcement one way or the other in order to get this person wherever they need to be, especially if they're violent. And our goal more than anything else is keeping these people out of our jails and to keep them safe. The training, like I think you said it's House Bill 1122 or 1222, that requires at least one CIT trained officer in every department. I mean, that's a good start, but that's every one of them needs to be trained. And that should be our goal in moving forward.
Chief Winter, other than training, what else do you think could help law enforcement in this area?
Well, again, at the end of the day, way too many of these people end up in the county jail. Now that's just the reality of it. And where we have our greatest problems and where it's the greatest possibility of injury, not only to an individual who is in crisis, but also injury to the officers, is that initial response. And CIT training addresses that, but at the same time, we need to make sure that statewide, and when I say statewide, I'm talking about in every jurisdiction, that we have the properly trained people there to move forward with these individuals other than law enforcement.
Thank you. Thank you. You're right. Law enforcement is a huge component of this because especially in rural areas, I mean, you are the one to respond.
Well, and that's the way, I mean, that's the reality of it. And we realize that, but at the same time, at the end of the day, our sheriffs do not want these people in the county jails. You guys do not want these people in the county jails. But we have counties that don't have hospitals. So,
yeah,
what do you do? I mean,
that's right. And as Dennis mentioned earlier, just even the connection, the communication with the local hospitals too, because some areas that have hospitals, you have some hospitals that they don't want someone who has serious mental illness being taken to the emergency room. So I mean, even in some areas where you have hospitals, you have some pushback on that. So you're right.
I noticed in the presentation, talking about the number of calls from Sharkey County in February. Of course, I know that the tornado was the next month, but I was sitting here thinking, does Sharkey County even have an emergency room?
No, they do not.
I don't think they do.
They do not. They do not.
So I would venture to say that most of the people in Sharkey County highly depend upon the health department there. And that's probably one of the reasons why you had that number of calls. They don't have anybody else to turn to.
That's true. We were thinking about that for Washington County too. It's an area in the Delta that doesn't have a lot of resources. So, and that was one of those top 5 ones as well. Okay.
Yep.
We appreciate your feedback greatly.
Thank you.
Hey, I have a question, if you don't mind.
Absolutely.
This is just I'm with the Mississippi State. I want to know as relates to the training. Does training consist of like demonstrations or scenarios that involve simulation, or is it pretty much kind of presentations, just kind of going over what to do in these particular instances?
Justin, you broke in and out a little bit, but I think I caught the gist of your question. And it depends on the training, but the two that we mentioned with House Bill 1222, the crisis intervention team training and the mental health first aid training, those both incorporate scenarios and role play.
And so far as the training for all of my volunteers, as well as all of my 988 crisis counselors, it's going to include a listing of all the different things that are part of our accreditation. And it uses multitude of different kinds of, there's going to be lecture, it's going to be role play based upon those particular topics. It's also going to be observation of individuals taking calls. All of my staff are required to go through at least 3 observations where they're observing someone that that's taking calls, and there's a checklist that they have to go through. And then the last observation is they're taking the calls, and the other crisis line staff person is observing them. So that's kind of, and like I said, it's based upon our criteria, based upon our accreditation through the International Council for Helplines. Also, our 988 dedicated staff are required to take ASSIST, Applied Suicide Intervention Skills Training, and I am a trainer, and so is my assistant director.
Awesome. Okay. Do y'all have any recordings of this where the staff can go back and watch it if they needed to kind of brush up on, a particular scenario or what to do in this situation or what to do in that situation?
What I end up using in that particular case, we have taped different sessions in the past, but one of the things we take advantage of is that the Lifeline, if you go to their website, there's a special network portal that's specific for Lifeline call center staff, and it has all the different scenarios. And so you can practice that way, and that's something else that I ask my staff to do. And then, of course, there's routine tip sheets that you can get from there. And also, too, that's also part of the new training thing that the Lifeline has got, is that they're going to be requiring is 3 workshop kinds of things, each of them lasting about an hour and a half, that they want all Lifeline staff people to go through. And that's something that we have just gotten that information. So that'll be kind of a follow-up too. We also have a newsletter that I get out every other month. And so I kind of look at trends, because myself and the 988 lead person, we read all the call sheets. So when we see kind of a pattern of different kinds of things, scenarios, then I try to address that also in the newsletter, as well as reaching out to that person.
Okay, well, that's awesome. So listen, I want y'all to know that this is an area that's very, very important to me. I'm internal medicine by training, but mental health is a very important this area of concern. So if there's any way that I can help, as it relates to the health department within these training and different things like that, let me know. I know I was asked by UMC police to come and do some speaking and come in and doing some doing some engagement and some training. But yeah, anything that I can do to be a resource as it relates to this, let me know. I'm also the son of a retired police chief. My dad used to be a police chief in Vicksburg and in Natchez, and former president of the Mississippi Police Chief Association. So this is something I'm really, really passionate about helping out with. So don't hesitate to reach out if I can help with any of these efforts.
Oh, that would be great. Yeah, I'll try to see if I can get about getting your contact information after this particular presentation.
Awesome.
Thank you, Justin. We appreciate your passion too. We can see it, and I'm glad you're a part of this. Anyone else have any feedback? Okay, so we will be reaching out, most likely individually, to make sure that we gather your feedback for this report. And in the meantime, like I said, these 5 components that you see on your screen, if you can look at those and reach out to us as well for any suggestions or recommendations that you have for us to address in the report. And then we will send out a poll in the coming weeks to schedule our next meeting date, because we do want to meet at least one more time to discuss the report, and then, of course, share the draft report with you before it is shared with the legislature. So, does anyone have anything else before we close?
I do not. I will send this PowerPoint out to everyone as well, and any resources that I think might be helpful. I'll include all of that in the email to each of you.
We thank you very much for your time and your feedback today. Until we meet again, have a great rest of your day.
Thank you.
Thank you.
Thank you.
Thank you.